What's going on YouTube? It's Gan and Mo. In today's video, we're going to be talking about a topic that resonates with many of us, healthcare burnout, and how you could prevent it by becoming financially independent. So let's get started.
Healthcare burnout is a topic that often goes ignored, and a lot more attention and light needs to be placed on it. It's actually a lot more prevalent than we once thought. The Journal of Graduate Medical Education recently published that upwards of 45% of medical students experience burnout at some point during their education, and 75% of residents experience burnout at least once during their residency. Now, those are some scary high numbers, and those are numbers that are often brushed under the rug, but a lot more attention and light needs to be shed on it.
The National Physician Burnout, Depression, and Suicide Report in 2019 claimed that 44% of physicians experience burnout at least one time throughout their career. So let's explore some of the factors that actually can contribute to that burnout. Inability to maintain an appropriate work-life balance, inability to maintain an appropriate sleep schedule, and working in areas that result in high stress and anxiety, such as the emergency department and critical care units.
And seeing a lot of sick people every day and knowing that they're in pain, as well as having to make very critical decisions and being somebody's safekeeper, realizing that their livelihood depends on you and carrying all that stress on your shoulders day to day does have an impact on your well-being long term.
So how can financial independence be the cure to prevent healthcare burnout? Well, one of our idols, physician philosopher, stated, "Fight physician burnout with financial independence." So what does that mean? Many healthcare providers' livelihood is dependent on their performance at their workplace, living paycheck to paycheck basically. And that's not the factor that you want to consider, and that's not the reason you went into medicine. You went into medicine because you enjoy taking care of others. So building that financial independent background, that passive income, will allow you to better experience your job, better take care of others, rather than relying on the income level that job is providing you and being stuck in the system.
To combat healthcare burnout, you should consider the option of part-time work or early retirement. In order to do so, you're going to have to front-load those early years of your working life. You're going to have to work 75 to 80 hours a week instead of the typical 35 to 40 hours a week. That way, you're going to be able to achieve financial independence a lot sooner. And then you're going to be able to own your own time. You're going to be able to travel when you choose to. Spend time with your family whenever you want. Do whatever your heart desires with your free time.
Stresses of the healthcare professional in the real world are led by large organizations, insurance companies, hospitals, expedited patient turnover. That leads to healthcare professionals not being able to treat patients the way they were trained. Working 75 to 80 hours a day, working 30 years and only retiring after 30 years, that's not an option. That's going to lead to the burnout. You have to start achieving financial freedom early in your career so you don't get stuck in that system. You already dealt with the stresses of graduate school. You don't need to go your whole life under high levels of stress just to lead to burnout and unsatisfaction in your job.
Now, the average physician salary in 2020 is $224,000. Yes, that's a lot of money, but there is one caveat. If you don't work, you don't see patients, you don't make money. And that's a very hard thing to deal with. It's unfortunate whenever your self-worth is determined by the job that you have. That's why it's important for you to reach financial independence early and create a lot of different sources of passive income so you can escape that rat race. You can invest in stocks, you can invest in real estate, you can start a blog or a vlog like we did. Those are going to all help you become less reliant on that paycheck, and you're going to be able to live a more fulfilling, relaxed life.
Have you experienced burnout either during your education, training, and or career? If so, let us know. And how did you overcome it? And of course, gingerly tap that like button so we can spread awareness regarding healthcare burnout. And we'll see you next time.